Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal Rx.
If you're considering having hand surgery because you've tried everything else for your carpal tunnel syndrome, but it just hasn't worked, then your doctor has probably told you there are two types of surgeries that you can have. The first is endoscopic surgery, and the second is open release surgery. Carpal tunnel syndrome occurs because the area inside the wrist, known as the carpal tunnel, becomes narrow. This narrowing causes the median nerve, shown in red, to become compressed, and that causes the hand pain and other symptoms, here shown in white speckles. Both surgeries aim to cut that broad band of tissue, here shown in white, in the carpal tunnel that is pushing on the median nerve. The main difference between the two surgeries is that in open release surgery, a large portion of the wrist is opened to expose the transverse carpal ligament in order to cut it. The upside to this surgery is that the surgeon can see clearly where to make the cut. The downsides of this surgery are numerous and related to the size of the cut made. They include excessive bleeding, infection, prolonged healing time, and possible loss of hand function. Endoscopic carpal tunnel surgery is less invasive because it requires making only one or two small slits in the wrist. A very thin surgical knife is inserted through one of these small openings, and the transverse carpal ligament is slit. This surgery has tremendous advantages because the wound that is made in your hand is much smaller. The downside is that the surgeon cannot see what he's cutting, and potentially the median nerve can be slit also, and this would damage the hand permanently. Both surgeries have their own risks, and studies show that most patients are dissatisfied with their surgeries. Make sure you and your doctor discuss why most people are dissatisfied with their surgery, and that most people are quite satisfied with their non-surgical therapy results. Your doctor should candidly and openly inform you of this because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Remember, those non-surgical options that everyone should use first are resting your hand, splinting, especially at night, and deep tissue massage, which is almost 100% effective in relieving symptoms. But it must be applied professionally and every day for at least 2 to 4 weeks. Anything less or improperly applied is useless. And to get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal Rx will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal Rx. If the Carpal Rx doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal Rx was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal Rx automatically produces the same motions that a therapist uses to relieve pain and other symptoms, and it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal Rx will do the rest. The Carpal Rx always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal Rx is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal Rx at carpalrx.com.